Hey everyone, my name is Emaan Chaudry.
And my name is Danielle Solish, and today you're listening to our 25th episode of Seeing Clearly, a pre-clerkship guide to all things ophthalmology. On today's episode, we are very excited to be interviewing Dr. Ike Ahmed.
So I'll just start out by introducing Dr. Ahmed. Dr. Ahmed has been a leader in novel treatments for glaucoma, cataract, and lens implant surgery. His pioneering work in innovative glaucoma surgery includes coining the term microinvasive glaucoma surgery, or MIGS. Dr. Ahmed is a professor and the director of the Alan S. Crandall Center for Glaucoma and Innovation at the John A. Moran Eye Center at the University of Utah. He's also an assistant professor at the University of Toronto, a research director at the Kensington Eye Institute, and the director of the Glaucoma and Advanced Anterior Segment Surgery Fellowship at the University of Toronto. In addition, he's also the head of the ophthalmology division at the Trillium Health Partners in Mississauga, Ontario, and he's recognized as one of the most experienced complex surgeons in the world.
So without further ado, we'd like to introduce Dr. Ahmed.
Hey, Emaan, Danielle, thank you so much for the invitation. Congratulations to both of you for putting on this program. I feel like I'm in a bit of the hot seat, so I'm prepared for all your difficult questions and looking forward to sharing some of my thoughts with you.
Thank you so much for being with us today. We know your schedule is insanely busy, so we'll just jump right into our first question here, which is, could you talk a bit about your journey to ophthalmology?
Sure. As every typical brown guy growing up in a very white world in Saskatchewan, my dream as an immigrant from immigrant family was to be a physician. And so I applied to medical school and was super keen on doing surgery. I love working with my hands. I love seeing the results of our physical work. And I was all immersed into surgery. And then I was lucky enough to do an elective in ophthalmology in Toronto, where I did my medical school. And I just love the fine technical nature of our specialty and bringing back sight and the technological advances that we have in our field. So I jumped in and I've never looked back. I did a residency in the University of Toronto. And at the time, and even now, a lot of sexy areas to be in: cataract surgery, refractive surgery. But I felt that, glaucoma was one of those areas that was kind of falling behind, and there was still a lot of work to be done. So I decided to pursue a career in glaucoma. A lot of people were not applying to glaucoma fellowships, and there was a lot of things happening in innovation in glaucoma, but I've always kind of been a bit different, not following the crowds. And so I jumped into glaucoma and been trying to see things differently in this field, and came back from my fellowship from the US to Canada. And ever since then, I've been devoting my career and my time to glaucoma and complex work.
That's amazing. Yeah, it's really interesting because a lot of medical students, they think of surgery and they don't even think of ophthalmology, and then they tend to stumble upon it. So definitely our podcast trying to make everyone a little bit more aware. Just a quick follow-up into, you talked about the fact that you specialize in glaucoma. Can you just tell our listeners a little bit more about what this entails, why you chose to subspecialize in it, and kind of what the day-to-day is like as a glaucoma specialist?
Sure. Obviously, you're right. One of the benefits of ophthalmology is it can suit so many of us. Some are more on the medical side, diagnostic side. And if you're surgically oriented, then certainly you can dive right in. And I tend to be more on that side of it. Of course, ophthalmology, we have a lot of mix. But, I've always felt that there's certain diseases, I think, that are best dealt with surgically to, fix the problem. And with glaucoma, for the longest time, we've primarily been treating this disease with eye drops to try to Band-Aid solution to the problem. And so that was, my interest is to develop surgical areas. I think for me, I thought a fellowship would be a natural, evolution to me to kind of further refine my work. I think that, there are so many specialties that within ophthalmology, for example, that one may be interested. And I think finding something that can pursue your passion, especially academically and research-wise, fellowship was important for me. I actually, though, even though I did my fellowship, I ended up practicing primarily in the community. And so although I was very academically driven and research driven, because of many reasons, one reason was, quite frankly, that there was no opportunity. And in fact, I was dissuaded from coming to the university for different reasons. I wasn't welcome. And so despite that, I still did everything I could to try to do things academically, and basically built my own work in the community as a glaucoma specialist. So I think whether you do a fellowship or not, whether you decide to pursue academic career or community career, I certainly think a fellowship can do a lot to kind of add extra dimension to your career.
Thank you for that insight. I just had a quick follow-up on that. You mentioned, you mainly work in the community, but you have an affiliation with some academic institutions. You maybe mind giving our listeners an idea of what a week in your life looks like? I know it can vary quite drastically, but just generally speaking.
Sure. So when I came back from my fellowship, basically we essentially built our own clinic and devoted a lot of time to hire research staff. I put aside my own personal income to support research and teaching, and did it on our own, and basically built that up. Now, of course, it's self-sustaining. So and now I've actually gone back and done work at the university. So my week is split up. My month is split up. Well, actually, I held 2 appointments. One of my appointments is in Toronto, and the other one is in Utah. So I actually spend 1 week a month now at the University of Utah. As you said, I direct the Glaucoma Center of Innovation, and that's where I did my fellowship. So I spend 1 week there every month, and I direct a very large program for innovation, a lot of basic science research, a lot of surgical, device development, as well as neuroprotection and genetic and gene therapy development. And so I work on that area and do some surgery and clinical work. My 3 weeks is the rest of my weeks I spend in Toronto, where I primarily work at Prism Eye Institute, and I operate pretty well, 2-3 days a week, primarily teaching fellows. One of my big passions is teaching, so I love teaching fellows and residents, and I do spend some time downtown at the university as well, primarily resident teaching, and run clinics. So my month is pretty busy. I do like to spend at least a day a week or more to do writing, to read, to present and do other things. And then, of course, I also go around the world to teach and do surgery as well. So that doesn't quite add up to 30 days. In fact, it's probably more than that, but I somehow find the time to split time between all these different areas.
Yeah, for sure. And still have the time to be on our podcast. So that's wonderful.
Absolutely.
Just there's a bunch of things that you said that we're going to want to talk about. Well, we'll first start with, you talked about innovation and working in innovation specifically in Utah, but can you just tell us a little bit about your motivation for, being so innovative, and, what kind of outcomes have you come up with or have developed in general in glaucoma from this innovation?
Yeah, I never thought myself as being innovative. I just ask a lot of questions. I don't settle for the answers that I get from textbooks or from, teachers or those that have come before me. And respectfully, I try to, challenge the norm. And that's just the way I've been growing up. I mean, just being very different. Quite frankly, I think some of it is genetic. Some of it's just, the nature of how we are as a general personality. But I think also innovation comes from learning as well, learning how to challenge and how to look at things differently. And it can be taught as well. So for some of us, I think it's genetic, some of it is innate, some of it it's environmental. I think it's a combination of all of that. And I hope all of us want to do better. I mean, I think I've always thought there's always a better way to do things. And with that philosophy, and do it respectfully, I think it's very easy to kind of start to just, diss everybody and say I can do it better. But I've always felt it's important to keep your ego at check and do it respectfully. And that starts as a medical student in residency. Some of the best discoveries in medicine started off from medical students, because I think medical students are, as a medical student, you're less polluted and you're less dogmatic, because you're still opening and you're still learning. And as a resident as well, early in your career. For me, some of my inventions and some of my things I developed were very early in my career as a resident. Once you get older and once you're in practice, you kind of get crystallized, your mind gets a bit more, rigid, and I think you're generally less able to innovate. So I encourage those that are your, medical students and residents and early trainees and early careers, specialists, to really get in there and don't be shy about thinking differently and expressing that and having a good environment to do that. So that was my benefit. I had great mentors down at University of Utah, for example, that allowed me to do that, that allowed me to kind of express my ideas and accepted that and respectfully were able to develop them. I've had other training places where I've trained where, in fact, it was very different, where I was shut down, or where challenging actually was disrespectful. And therefore you keep quiet and you kind of lose your confidence. So I was lucky to have the right mentor at the right time. So for me, like I said, I kind of went into glaucoma. Probably most people would probably see my areas of contribution, if there have been mainly to look at glaucoma differently, not in a passive way, but in an active way. I've kind of coined the term interventional glaucoma, where we try to intervene earlier in disease with interventional therapies like laser, surgical, microstenting, microinvasive approaches that are safer to do than traditional surgery that can be offered to patients earlier to improve quality of life, to stop disease earlier and have better control and hopefully better outcomes in the long run. And that's kind of mainly been my area of work with microinvasive glaucoma surgery and MIGS. The other area I've been involved with has been doing complex surgery, which is to look at cases that probably most people would not do, or there were not great outcomes, and to really hone down the right surgical technique to improve those results, particularly trauma or congenital conditions or postoperative complications. So I started off my career doing a lot of those complex cases nobody wanted to do, and fortunately enough had enough success to develop enough technologies and techniques to manage those cases. So a lot of it is just thinking differently, is having the right mentors around you to help you spread your wings, and being in the right place at the right time as always, and the right people. I probably was lucky, honestly. I didn't end up at a big university where you have to conform and follow departmental policies and not waver from the traditional approaches typically, although that's changing a little bit. And I was out in a very small, tiny hospital with 3 ophthalmologists and myself, and nobody kind of overlooking you and basically telling you have to do certain things. And I was allowed, luckily at my hospital, Trillium Health Partners in Crandall Hospital, that they allowed me to do this work. And little known that this is now spread around the world. I mean, not to boast, but man, we've been fortunate to be at the forefront of this in a sleeping community in Mississauga. Who would have thought, but that was my path and my journey. At the time, I was not happy. I was upset. I wanted to be at the university, but actually ended up being great. So that's my story.
Well, thank you for sharing your story and providing the insight to our listeners. You really emphasize that when one door closes, another one opens, and to continue to answer to your curiosity. And so it's really inspiring for myself and Danielle, but also all of our listeners. In all of that, you mentioned a little bit about how you're passionate about teaching others and specifically your work with fellows. And we have a lot of listeners that are learners that listen to our podcast. And so we were just wondering if you could expand a little bit more on any advice you have for our learners, whether they're med students, residents, and interested in ophthalmology or not, I guess. You touched on it a bit, but if you don't mind going into a bit more.
Yeah, I mean, there's nothing better than to be inspired, and hopefully to inspire others. And I think and a lot of this is really through relationships. I mean, I think there's one thing that I feel has been most beneficial of the people around me. And I hope that's translated to me wanting to also help, those around me as well. So I think find the right mentor who can inspire you, but also hopefully open doors for you as well are important. Medicine is still very much a hierarchical specialty. Where who makes a difference, who advocates for you makes a difference, and who works behind the door to help you behind closed doors. That's the reality. That's the politics of medicine, and it's very true. I don't think things are necessarily fair in life, and they're not necessarily fair in your journey in medicine. I'm going to be honest with you. I mean, many of you are going through interviews and stuff. The reality is that, whatever, better for worse, those are the realities of how these processes work. But I think so, hopefully finding someone who's fair, someone who's a good mentor who can inspire you, and someone hopefully who can open some doors for you are what's important. Do it for the right reason, but realize that no matter what anybody says, including myself, and I want to be altruistic, it is a game. Learn the game. Learn the insider situations that happens out there from someone you can trust, and play that game. I know it sounds really bad to say that, but that is the reality. If you don't know how the game works and how the process works, even as altruistic as you are, unfortunately, you may be left outside. So don't lose your values, but know how the game works. Know how people work, and know that we're human beings and we all have our weaknesses. So, without ranting, I want to tell you that just, stay true to yourself, but at the same time, know the system works. Find good people you can trust. That's probably the best important thing you can do. You never know who it is. It may be somebody you walk down the hall and you bump into them and you have a conversation, and now it leads you to do something that you can now achieve well with. So, I mean, that's what I would say. And fortunately in our field, there are many great people that are around that can help you. I mean, I truly believe there are good people. Don't get me wrong, but the system is difficult, of course, because there's limited exposure to the field and limited exposure to the programs.
For sure. And yeah, for sure, finding a mentor, finding someone you trust, helps you to learn so much about what's going on, get you exposures, helps to also foster your curiosity. If there's something you want to do, then when you work with someone else, they can help make that action, that plan into a full action. So I completely agree.
Yeah, and I think taking things under your own control are important as well. I mean, there's only so much you can rely on other people. I mean, like look at both of you. You started this podcast. You did it on your own. You don't need anyone to do that for you. You did it by yourself. each of you in your journey can do your own thing without needing to rely on anybody. I mean, more than ever, you got the internet, you got YouTube, you got podcasts, you got social media, community work that you can do. You don't necessarily need to have someone to open every door for you. So you can do a lot by yourself, particularly if you do it for the right reason. And my advice would be try doing something different that not everyone's doing. I mean, if everyone is doing podcasts, then don't do podcasts. Do something different. There's always going to be some way to be different, and I think that being different can shine, a different kind of light on you. Being innovative and providing something that maybe others don't. Maybe it's another area of interest, or maybe collaborating outside medicine, whatever it is. That uniqueness will shine when it comes to, for example, interviews, or when it comes to, well, I want this person on my team because they bring something different.
And no,
So don't be a follower.
I just had a follow-up question on that is, how do you deal with, I guess, the pushback you receive in being different or in being unique and following those passions? I'm sure you've encountered some challenges, so it'd be nice to hear how you dealt with that, just for myself and Danielle, and then also our listeners to learn from.
I'm generally a pretty positive person. I'm optimistic. I like the glass. I'm always like the glass is half full. But I'll tell you, man, I get down sometimes because there are a lot of people who don't want to see others be successful. I hate to say it, or are only looking after their own interest, and it's all around us. And I don't want to be negative again, but the reality is that people don't always want to see other people be successful, especially in the same area or the same city or the same program. And there are haters out there who are more protective about their own turf. It's medicine. It's reality, folks. This is the reality and the ugly side of medicine. And I've seen it, and I hope I don't propagate it, but the reality is you kind of get sucked into this system. So I try to be very positive, though. I feel like, there's enough achievements out there that we can win and do it respectfully. And at the end of the day, it also depends how you define your achievement. For me, defining achievement is not by titles. It's not by awards. It's not even by publications. I mean, for God's sakes, I'm still an assistant professor at University of Toronto. You know why? I don't care about being a friggin' professor. I don't feel about getting a title of something. I don't care about those awards. For me, I really value, though, what I think is what I hope is important, which is making a difference in people's lives. My patients, my trainees, if I can make a difference in their lives and be part of their journeys and see them be successful, that to me is what I love to see in my achievements. So despite all those challenges, whatever, if you define your achievement, hopefully in the right way, you'll be satisfied in that nature, and keep on moving forward. Be positive, bring energy. I think energy to me has been really what my fuel has been, the adrenaline energy to drive forward, to make those differences and jump over those hurdles. There's always a better way. There's always somebody who's going to be in your way. At the same time, there's always somebody who's going to also help you on your way. So find the right people to work with, create a good circle of friends around you and people that you can work with. And then you'll be surprised down the road. The same people who are in your way are now wanting to be in your camp and follow and be part of that success. So know that can happen. And there are doors that close, absolutely, but trust in your journey. Keep on pushing forward, but also accept the fact that not every door is going to be the door that you should be going through. And, trust that process and find that right tug of war and that right balance to do that. And I think you can do it. I am thrilled to be an ophthalmologist. I'm thrilled to be a glaucoma specialist and anesthetist surgeon. I'm thrilled to work where I work. I'm just so grateful for that. I don't deserve it. I feel I'm fortunate and blessed to be what I am. But I also know that process and that journey was very difficult on many levels. And I was very fortunate to have be at the right place at the right time, the right people.
Sure. Yeah, thank you for sharing that. It's true. There's always going to be some sort of a roadblock, and it's about, keeping the attitude, keeping the positivity, developing a team of very supportive people who help you to get through that. So that's incredible. Thank you. And
yeah, it took me 4 years of medical school, 5 years of residency, so 9 years of my training and 2 years of undergrad before that, before I found the right person to be my mentor, which was my fellowship mentor, the late Alan Crandall. Before that, I didn't feel I had that, and I had a lot of struggle, honestly, a lot of struggle to get where I'm getting. If people see me now and go, this guy's successful as everything else. Not at all at those times. So know that, and you'll find that, hopefully with the right intention.
It's true. We always compare our current selves to someone else's maybe end goal or end game, and it's impossible to do that when you haven't completely appreciated their journey. So it's true. With that, we're going very positive note. We're going to transition to our last section, which is our Would You Rather section, a little bit of lightheartedness for our listeners to learn a bit more about you. So Emaan will start us off.
Yeah, so with our first question, we wanted to emphasize the importance that people have played on your hair. I don't know if anyone's seen the Dr. Glaucomflecken TikToks, but this one kind of is inspired by that. Would you rather have to wear wet socks every day or only be allowed to wash your hair once a year?
That's a tough one. I mean, for me, I'm very particular about, having the right footwear, to be honest with you. And I'm probably a little bit particular about hair, although I've cut my hair a lot actually in the last few months. That's a tough one. I would probably, I'm probably going to answer, I would rather wear wet socks because I got to keep the hair thing going, right? And I would find a way to kind of ignore my feet. It's very, the human brain's amazing to ignore what you don't want to see or feel. So that's probably what I would choose here. I got to keep the hair thing going for as long as I can anyways.
It's true. Got to preserve it. It's quite, yeah, I'm going to need the hair routine afterwards.
Exactly.
And my question is, would you rather live in a world without music or without books?
So, that's another tough question, which I guess they're meant to be. I'm probably more of a music person. And so I wouldn't want to give up music. I think music kind of helps to inspire you, helps to calm you down at certain times, helps to motivate. And I think that I can hopefully learn through other ways than books, maybe through, conversations and one-on-ones and watching videos, I guess, which is what a lot of people do anyways, or listen to podcasts. So there's my easy answer to get out of books.
Yeah, I was gonna say, I guess you could kind of cheat the question and say you could listen to audiobooks as well. So, but with all of that, Dr. Ahmed, I just want to say thank you so much for joining us. We know you took some time out of your busy day, so we really appreciate it. And to all of our listeners, thank you so much for listening to this episode of Seeing Clearly, which is our pre-clerkship guide to all things ophthalmology. To stay caught up with everything else iCurriculum is doing, be sure to check out our website at www.icurriculum.com and to follow us on our social media at iCurriculum. Thank you again, Dr. Ahmed. We were really honored to have you on our podcast, especially for our 25th episode.
Well, thank you very much. And congratulations to the work that you both are doing. And I wish you so well in your careers. I think being a medical student is an amazing time in your lives. And I know there's uncertainty as well with it, but trust me, it's worth all of it. And I'm always pretty blunt. I don't mean to be overly negative, but I want to just tell you, listen, you're going to have an amazing career. It's going to be fantastic. It's lovely. Ophthalmology is the best. And make a difference, make a positive difference. Even though there are some challenges in our system, be that difference maker. And I'm confident with the way we're going in society that we make things more fair and open, and the next generation continues to improve upon the last generation. So good luck with everything. And I hope I'll see many of you on our pathways.
Thank you so much.